World Mental Health Day on the 10th of October. The conversation must continue. So we're looking at mental health. We've talked about what the word mental means, and we've seen that really it just means pertaining to the mind, pertaining to the will, the intellect, and the emotions. So it's not something vague, it's something really tangible, something that we can understand. So now let's have a look at not just the components of the mind, but the things that affect the mind. Again, it's three main areas. We're talking about biological or physical health factors, social factors, and psychological factors. If we understand what affects the mind, then we can address those factors in order to have good mental health. So when we say biological, the first area, we're talking about physical health factors. So our physical health has an impact on the mind. For example, chronic physical illness can affect the mind. Having a low thyroid function or anemia can affect the mind. So those are biological factors. Sometimes physical health medications can impact the mind too, perhaps leave us feeling a bit fatigued and a bit wary of life. But those are physical factors, and those are things that can be addressed in order to optimize mental health. And then we have psychological factors. So those are things usually dealing with our emotions, our relationships, our experiences. Again, those are things that can be addressed, that can be looked into. And finally, social factors. So the third bit, we're looking at various aspects such as finances, accommodation, employment, studies. Those sorts of things are addressed under social factors. So these all have an impact on the mind. When we're talking about mental health, we need to look at all three areas: biological, psychological, and social. These three areas can be addressed in order to optimize Mental Health Day. Mental health, let's talk about it.